Ivy, 462 Washington, and 710 Krebs. Is everybody okay with them withdrawing their bills?
Yes.
Okay, that's a consent calendar. All in favor, say aye. All those opposed, no. Raise your hand.
Aye.
Aye.
Thank you. House Bill 34, Lisa.
House Bill 34 is an emergency bill that requires the Maryland State Department of Education and the Maryland Department of Health to authorize a healthcare practitioner at a school-based health center to provide services through telehealth consistent with specified provisions of the health occupations article. The bill prohibits MSD and MDH from requiring an approved school-based health center to submit an application or seek approval to provide telehealth services or establish. It prohibits MSD and MDH from establishing requirements for school-based health centers to provide telehealth that are inconsistent with specified current law.
Delegate Cullison.
Thank you, Madam Chair. We had a rich discussion on this bill and we covered it over 2 subcommittees. It's a very important bill because what it does, and the reason it's an emergency bill, is school-based health centers are currently closed in most places because the schools are closed and the students are not getting the primary care and the behavioral health services that they need because it is so difficult for them under the current standards and policy of MSDE to be able to do telehealth. We passed an emergency telehealth bill in 2020 to allow for telehealth across the state in all different venues and with all licensed and certified providers. Yet school-based health centers could not benefit from that bill. And what's more important is the students could not benefit from that bill. So this bill is designed to overcome the barriers that have been put up to our school-based health centers, delivering services and the continuity of care that the youngsters who are served by these school-based health centers, which are students who are affected by poverty. These centers only exist in schools where there's a high incidence of poverty in the community. So we think it's very important. And the bill, there was an amendment that was rejected by the subcommittee, and then the bill passed unanimously without the amendment. So I'd like to move the bill.
Is there a second?
I think I have an amendment that I'd like to offer.
Delegate Kipke.
Lisa, I think you have that amendment. And
The amendment was emailed out to everyone earlier today.
Right.
great. Okay. So the amendment would prevent tele-abortion services being provided at school. Now you might ask yourself, why is that even an issue? And it's an issue because the FDA could change the rule, and it's currently being evaluated as to whether or not certain types of abortion drugs can be administered through telehealth. It is currently a policy of schools to not have any involvement except for referrals out to providers as it relates to abortion. But this amendment is being offered just to ensure that telehealth in schools doesn't ultimately end up being used to provide telehealth abortions should the FDA change its regulations.
Delegate Cullison. Oh, would you move the amendment?
I move the amendment.
Is there a second on the amendment?
Second.
Delegate Cullison, would you like to speak to the amendment?
Thank you, Madam Chair. And I would ask the committee to resist this amendment. Again, I want us to focus on the purpose of this bill. And as my good colleague said, it is currently prohibited by MSDE standards and policy to provide any kind of information on counseling around termination. In fact, anything regarding pregnancy support is referred to another entity. The way the school-based health center rules work is that there are guidelines that are determined jointly between MSDE and MDH, and no local entity can do more than what's in those standards and policy. They can do less. Not, for example, some school-based health centers offer dental services, others do not. Some provide behavioral health, others do not. So the decision around the specific services that are delivered in a locality are determined by the leadership of the local district. And so I would ask that we just, like I said, allow it. What school-based health centers are doing are primary care, dental in some cases, behavioral health in some cases. This is their focus, and this is what we need them to make sure that they can deliver through telehealth. We don't talk in standards about what it can't do, what they can't do. That would be a laundry list of things. So I'd ask us to keep the bill clean and concise and be focused on the work that needs to be done for these vulnerable students, and resist the amendment.
Okay, I'm going to ask people if they want to speak, or they need to put up a raised hand in the panel so I see it. I see no discussion. Delegate Shalega. Did you put a hand up? Oh, there we go. Just now.
Oh,
Okay,
it's late to finding my hand. Sorry.
fair enough.
I would speak in favor of this amendment that, if they're currently not doing this, there's no harm in just stating that we don't want them to do this in the future. And after, speaking on this amendment, I'm going to have a question about the bill, but I'll wait since we're on the amendment right now. Thank you.
Any further discussion on the amendment? Okay, we will do a voice vote. Yes. And we will do a hands up for no, as we always do, if that's not too confusing for you. Do you find that, actually, maybe what do you think, Kipke?
Reverse it. I would reverse it.
Okay. Oh, hang on, I got to turn this off. Okay. Come on, be quiet.
That's sexy though.
I turned the sound off. How can it be making noise when I turn the sound off? I don't know, but it better not do it again.
Or else what?
Okay, so a no vote, I'll ask for the yays. And then the no votes are going to raise your hands. But the yays will just be yay and the no's will be icons. Okay? Okay, so all those in favor of this amendment,
Madam Chair,
did I say it backwards?
Madam Chair,
Of course, yes.
I'm on a phone and I don't know how to raise my hand.
Who is that?
Delegate Carr.
Carr.
Okay.
You gotta click on more. You gotta click on more, Al, on the bottom.
You know what, Carr, we'll ask you to do, you know what, we'll just do a roll call. We'll just go through a roll call.
Yeah.
Okay, staff, would you just call the roll on the amendment? A yes is a yes for the amendment and a no is a no on the amendment.
Melissa, I'm gonna let you do the roll call. You got it?
Sure. Chair Pendergrass,
No.
Vice Chair Pena-Melnick,
No.
Delegate Bagnall,
No.
Delegate Barron,
No.
Delegate Belcastro,
No.
Delegate Bandari. You're muted.
We don't hear you, Delegate Bandari.
Can I be abstain or I have to vote either way?
You're in the room.
Yeah.
No.
What?
Delegate
No.
Oh, thank you.
Delegate Carr,
No.
Delegate Charles,
No.
Delegate Chisholm,
Yes.
Delegate Collison,
No.
Delegate Hill,
Yes. No on the amendment.
Too late,
Doug.
Terry.
Delegate Johnson,
Lane.
No.
Delegate Kelly,
No.
Delegate Kerr,
No.
Delegate Kipke,
Yes.
Delegate Krebs,
Yes.
Delegate Lewis,
No.
Delegate Morgan,
Yes.
Delegate Riley,
Yes.
Delegate Rosenberg. You're muted, Delegate Rosenberg.
No. No.
Delegate Saab,
Yes.
Delegate Sample Hughes,
No.
Delegate Schlega,
Yes.
and Delegate Lewis Young.
No.
Okay, can you tell us the number of yes votes?
It's partisan.
Did I hear somebody say something?
I said what our old former chairman would say, it's partisan.
Partisan.
But when we say we have a philosophical differences,
I just,
I don't like partisan.
the
We're sick of
amendment,
partisan.
I know the amendment failed, but I thought officially I should have the number of the yeses to be clear
Yeah.
that it
It
failed.
would be 7 yeses.
Thank you very much for counting them for us, Delegate Shalega. Okay, 7 yeses, the motion, the amendment fails,
So I would like to move the bill.
which you already did, and it was already seconded.
It was?
and
Okay.
So if there is any further discussion,
Delegate Salega had a question.
Delegate Shalega.
Thank you. So tell us again about parental consent, and how telehealth is working with minors.
In order to be or to be served by a school-based health center, the parents have to consent to it. They have to enroll in the school-based health center. So any services that the student receives from the school-based health center would be with the permission of parents.
Is it a blanket consent, or is it, do parents know when their children are getting medical services?
Parents would be notified that their children are getting medical services. That's
Okay.
part of the agreement, right?
So I don't know, that's my question. So they do say your daughter is, saw a physician yesterday or is seeing a physician today, or there's some accountability to parents?
There's accountability to parents since
Okay.
they have given permission for the services, right?
Okay, I just am, if you could, I'm not going to hold the bill up, but I'd like to know on a future conversation with you and I, what that looks like. Thank you.
Okay. Thank you, Delegate. I'll get that for you.
And Madam Chair, Subcommittee Chair, I have a question. I'm on the subcommittee, but I just have a question that I didn't think to ask back then. It talks about getting rid of the.
Hang on. Is this Delegate Krebs? Oh, there you go.
It is.
Yeah. Thank you.
Sorry.
Delegate Krebs.
I don't know how to raise my hand. I don't know how to raise my hand either because I'm on my phone. It says under the bill, they could begin offering telehealth services without having to seek approval, which I understand to streamline it, or complete the telehealth checklist. Do they still have to follow the checklist? I know they don't have to get it approved, but do they still have to follow, what's on the checklist?
Yes. Yeah.
Whatever that is for telehealth, to make sure they're doing the right things.
Right. They would have all this, the standards would still be there. It's the paperwork. And just to be clear, Delegate Krebs, 13 school-based health centers in Montgomery County applied to be able for approval to do October.
Oh, look, I get the reason why. I just was looking at it, says they don't have to seek approval or complete the checklist. I just want to make sure that they at least have to follow the checklist. I don't mind expediting the process and letting them do it, as long as they still have to follow what they would have followed if they had to check. You know what I'm saying? They still have to follow the guidelines. Okay?
Yeah, I do.
Okay, I just want to check. Thanks.
Thank you.
Are there any other questions? I see no other hands in the list. Okay, all those in favor, voice vote yes. All those opposed, no. Put your hand up in the participants. So I see a unanimous yes.
On the bill, sorry, on the bill?
On the bill. That's what we're on, is the bill.
Yes.
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 Okay, everybody is a yes. I see no hands in the participants column or up on the screen. So with that, this bill passes unanimously. We'll move on to the next bill, which is House Bill 38, Tyler.
House Bill 38 would require the Secretary of Information Technology to develop cybersecurity strategies for state government units and local government units. It was passed out of this committee and the House last year and is a reintroduction. There was an amendment considered in subcommittee that would exclude the University System of Maryland, but that was not adopted in subcommittee.
Move the bill. Schlega
Delegate Rosenberg.
Yes, as staff has indicated, this bill is identical to last year's bill. Therefore, we would urge a favorable report. It's up to the Senate to deal with the amendment.
Are there anybody want to, move the bill?
Schlega says move the bill.
I second.
And Delegate Shalego, would you like to second? Oh, did Banderi second the bill? Did I just hear that?
Yes.
Okay. So the bill's moved and seconded. We're making progress here. Is there any discussion on this bill? Seeing and hearing none, all those in favor say aye. All those opposed, no. Raise your hand.
Aye.
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 I see no
Aye.
hands raised. This bill passes the committee unanimously, as it did last year. House Bill 95, Tyler.
House Bill 95 expressly authorizes advanced practice registered nurses to delegate nursing tasks to properly trained non-licensed staff.
Delegate Kelly.
The subcommittee loved this bill and passed it unanimously with no amendments.
Is there any
Move the bill.
Move the bill.
Second.
Thank you. Is there any discussion?
Bill is this?
This is Delegate Krebs' advanced practice nurses bill for delegation of
Oh,
tasks.
yeah, that's a good one. Thank you.
It's a good one.
Okay, I'm hearing no discussion, seeing no hands. All those in favor say aye. All those opposed, raise your hand. No in the icons.
Aye.
Aye.
Yes.
I see no hands. This bill passes the committee unanimously. House Bill 107, Lisa.
This bill repeals the prohibition on the sale, distribution, or disposal of drugs, medicines, pharmaceutical preparations, or medicinal preparations by means of a vending machine or similar device.
Delegate Cullison.
Thank you, Madam Chair. So we've all had those cases where we've been driving home and we've got a headache and there's nothing in the car. And you just want to jump out and get it quickly. You don't want to be bothered going into the gas station to buy the aspirin. And so you put your money in, or you slide your debit card or whatever into the vending machine and you get your aspirin. That's all this bill does. These are vending machines that have FDA approved over-the-counter medicines like aspirins, like antacids, like allergy pills, like Neosporin if you get a cut, Band-Aids. These are the kinds of things that are going to be in the vending machines. And the bill passed the committee, not unanimously, but by a supermajority. And I'd like to move the bill.
Is there a second?
Second.
Second.
Thank you, Delegate Hill. I think that was you.
Yes.
Is there discussion on this bill? If you put your hand up, Delegate Hill, are you wanting to
Yes.
speak to the bill? Delegate
I
Hill.
just have a quick question. And this, I guess, is directed to either Delegate or Chairman Pendergrass or Delegate Rosenberg. We used to be able to do this. I'm just curious about what was the rationale, or does anyone know when we stopped? We used to get aspirin out of vending machines at the Maryland House and other places in the state all the time. Can Delegate Rosenberg, any memory there?
Are you asking because of my seniority or because
Yes,
I'm
sir.
not
You've
chair of
been
the
in the General
subcommittee?
Assembly as long as anybody else.
Okay, okay. I never got a headache traveling, so I don't know.
All right.
Delegate
I don't want to
Cullison,
delay
do
things.
you have any
I just-
information?
I don't. I'm sorry. Lisa, I don't know if you do.
I don't remember that ever being an issue, and I've been on a health committee, but maybe not the health committee that would have legislated vending machines at the time.
All
I know
right, thank you.
I've never heard a discussion about this before this bill.
Thank you. I just
Okay.
needed to know where we went wrong.
No idea. Okay, I'm gonna,
Now we're seeing the error of our ways.
all those in favor,
I have a
please.
question.
Oh, yes,
Kipke.
Delegate who? Kipke, go ahead.
When I read the bill last night, it isn't one of those straightforward, easy reads. And I didn't grab the book that you have to reference to understand the bill. And I'm just curious for council, is it actually illegal currently to sell Band-Aids and Advil? I'm finding it hard to believe that that's the case.
No.
Lisa? It's,
Somebody's going tick, 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 tick.
Krebs, mute your, there you go.
So I am at home and I don't have my books, any books right with me.
If it's important to you, Delegate Kipke, we can hold the bill.
Well, maybe we could just get the answer before it's reported to the floor. It just seems like a very odd thing to me.
I can definitely find out. I might be able to find out by the end of the voting session even.
Okay.
Okay,
thanks.
well, we'll hold this bill to the end of the voting session, and if we don't have an answer by then, we're going to hold the bill, because I don't know how we vote the bill in this venue and then hold it. It's just a level beyond the complication I can deal with, okay? Okay, so we'll hold 107 till the end of the other bills. We'll go to 141, Lisa. Unfortunately, Lisa, oh, that's, yeah, you still have two bills, at least three.
Okay, 141.
Department of Health Residential Service Agencies training requirements.
Okay, House Bill 141 requires each residential service agency to ensure that within 45 days after an individual's start of employment, direct care and supervisory staff receive 3 hours of online or in-person training on dementia beginning July 1st, 2022.
Delegate Kelly.
There are some amendments. I'm sorry.
Sorry.
The amendments clarify the circumstances under which an RSA is not required to provide specified training.
Yes, thank you for that, Lisa. And with the amendment, the subcommittee voted for both the amendments and the bill unanimously. The amendment does, create that portability for the training. So in a workforce with a lot of turnover, if someone's had the training recently, they don't have to have it again with their new employer, which does bring down the costs. And with that, I move the bill.
Is there a second?
Second.
Is there any discussion on this bill? Seeing no discussion, hands. All those in favor say aye. All those
Aye.
no,
Aye.
the ayes have
Aye.
it. It's unanimous, and I see no hands in the panel, so I believe it's unanimous. Okay. House Bill 161. Lisa, do you want us to do your bills first and then go on to the other staff? Lisa?
Sure, that would be great.
Okay, House Bill 207, we're going to take out of order. Nursing home resident change in condition notification.
Okay, House Bill 207 specifies that a nursing home consistent with state and federal confidentiality laws must notify a resident and, if applicable, the resident's representative or interested family member within 24 hours after specified changes in the condition of the resident. There are amendments that alter the time frame for notification from 24 hours to immediately and include directions to transfer or discharge a resident to the reasons for notification.
Delegate Kelly.
Thank you. And with the amendment, the subcommittee supported the amendment and the bill unanimously on this one as well. And the amendment is going to basically conform the state law to the existing federal law. And the sponsor supported the amendment as well. I move the bill.
Is there a second?
Move the amendment.
Second.
Thank you. Is there discussion on the amendment?
Move the bill.
This is a blank.
We need to vote on the amendment.
Seeing no hands up and hearing no voices, I assume there's no discussion on the amendment. All those in favor say aye. All those opposed, raise your hand in the panel. The amendment passes unanimously.
Move the bill as amended.
Second.
Is there discussion on the bill as amended? Seeing and hearing none, all those in favor say aye. All those opposed, raise your hand. The bill passes unanimously. I'll go on to the next. Lisa bill is House Bill 554, Division of Consumer Protection Assisted Living Programs. Lisa?
House Bill 554 requires an assisted living program that was appointed as a representative payee for residents to report specified information to the Consumer Protection Division of the Office of the Attorney General by June 1st of each year. An assisted living program must report on the use of the following benefits by residents: Social Security benefits and any other federal, state, or local government funds that are allocated for the purpose of assisting individuals who are aged, disabled, or blind. There are amendments that clarify that OHCQ is required to refer an allegation of an unfair, abusive, or deceptive trade practice by an assisted living program to the Consumer Protection Division and the Office of the Inspector General within the Maryland Department of Health.
Delegate Kelly.
Thank you. The committee really loved this bill as well, and they supported the amendment unanimously as well as the bill unanimously. Move the amendment.
Second.
Any discussion on the amendment? All those in favor say aye. All those opposed, no. Raise your hand in the panel.
Aye.
It's unanimous.
And move the bill as amended.
Second.
Second.
Any discussion on the bill as amended? All those in favor say aye. All those opposed, no. Raise your hand in the panel.
Aye.
Aye.
Seeing no hands in the panel, this bill passes unanimously. And Lisa, House Bill 599.
This bill requires the Maryland Department of Health by April 1st, 2022 to develop and publish materials to assist Maryland residents with long-term care family planning. The materials developed must be consistent with recommendations made in the final report on long-term care education and planning. And there were no amendments.
Just want to say that the Health Ops Committee did a lot of bills this week for our frontline healthcare workers and our long-term care folks. So they loved this bill as well. Passed unanimously with no amendments. Move the bill.
Second.
Second.
Is there any discussion on this bill? All those in favor say aye. All those opposed, no. The ayes have it. That bill passes unanimously. Lisa, go figure things out. And with that, we'll move back to House Bill 161. Tyler. Tyler?
House Bill 161 will, as drafted, provides for the registration of audiology assistants in the state, but there was an amendment that would make it the licensure of audiology assistants.
Okay, Delegate Kelly.
Thank you. So this bill also passed with the amendment passed unanimously and the bill passed unanimously. The amendment brought the bill in line with what the Audiology Board was comfortable with in terms of their existing practices. So the committee supported the amendment. Move the amendment.
Any discussion? All those in favor say aye. All those opposed,
Aye.
no. Raise your hands. Seeing no hands and hearing at least one yes vote, I'll assume that's unanimous.
And move the
The
bill,
amendment passes unanimously.
sorry, move the bill as amended.
That's okay.
Second.
Script change,
Second.
it. You can't count on me. Is there discussion on the bill as amended? All those in favor say aye. All those opposed, no.
Aye.
Raise your
Aye.
hands.
Aye.
The ayes have it. It's unanimous. House Bill 161 passes the committee. House Bill 210, Tyler.
House Bill 210 would authorize State Board to grant a 90-day license to practice physical therapy or limited physical therapy to an applicant who's completed all but the testing requirements for licensure. While practicing under the temporary license, you would still need supervision from a licensed physical therapist.
This is another bill with no amendments that the subcommittee passed unanimously. We want to make sure these people can practice, and they're going to need a temporary license because of the change in the test schedule. Move the bill.
Okay, is there any discussion on House Bill 210? Seeing none,
I have a
hearing
question.
none.
Oh, sounds like Delegate Hill has a question.
Delegate Hill, I see your hand up now.
Thank you. It was slow. Delegate Kelly, just for clarity, other health professionals finishing up don't have to get a temporary license to license under licensed folks. So I'm just curious if you all in your deliberations were able to figure out why they need this and other health professionals don't.
As I understand it, this is actually the structure that this particular board used to use, and then they changed it a few years back when the testing became more regular. And so now that the testing is only every quarter, they really want to go back to a model that they were more comfortable with. And again, I see your point. You know, we're trying to standardize more things across more boards, but this is the proposal that the board was comfortable with working with. And it seems to solve the problem that is immediately at hand.
And the problem they had was, in other words, I was at the hearing and I remember them saying,
they had changed their statute.
no, but what was the problem they were actually having? I know they changed the statute and they went back and forth and the test became more regular and all that. It didn't explain to me why someone under somebody else's license would be problematic practicing. That's why you practice under someone else's license. So that because you don't have your own. So I didn't make the connection during the committee hearing and I only got one question.
I see. I'm just not sure I can answer that question. I think, let me see if I can repeat your question so at least I understand it clearly. If they're practicing under direct supervision, why do they need a temporary license instead of just being practicing under direct supervision? Is that
Correct.
the question?
Correct. Because when you're under direct supervision, you're under the other person's license anyway. So dental students, before they get theirs, they're practicing physicians, nurses, whatever. You're practicing under the license of the supervisor until you pass your license.
That's not the format that this board has been working under. Tyler, do you have any more information than that?
I'd have to double check to speak more confidently, but I do think that it's the distinction over like practicing under supervision versus, I guess you wouldn't call it necessarily practicing, but working alongside your instructor.
Well, and the reason I'm asking is because if you have your own license, that means unless they're making it other than being temporary, there's no other classification. So it doesn't prevent them from working independently. A license is a license, correct?
How about we hold this bill? We get the answer. Unfortunately, we didn't ask the question until today, but this bill will just get held.
Yeah, I'm not in the subcommittee, so, okay,
Well,
all right.
you know
I
who
can
the
talk.
chair
Who
is.
should I talk to, Delegate Kelly, to get the answers?
Can I add something?
Oh, Delegate Banderi, this is your bill, isn't it?
Yes.
Do you have
Yes.
an answer for us?
Might not be complete answer, but as Delegate Kelly explained it, this legislation previously existed in Maryland and repealed after the examination schedule was switched from fixed date to rolling date. and now they are back to the previous one, and that's what it is more like compatible. And implementing this legislation would help physical therapists and physical therapy assistant get to work immediately once eligibility requirements have been met. To Delegate Hill questions, there is a logic. However, I think they need to meet some eligibility requirement to practice, and this legislation would help to do that.
Delegate Hill, do you want to hold the bill?
Yeah, I just need to know who I'm supposed to get the answers from, because that's what I heard at the hearing.
Delegate Kelly, she chairs the subcommittee. She will get the answer before.
Okay, because it's sort of true and unrelated.
Okay, so I just want to make sure that I'm clear on what answer you exactly need. So I'm looking at the text of the bill, right? It says a temporary license issued to an individual who has completed a physical therapy assistant curriculum authorizes that holder to practice limited physical therapy under direct supervision while the temporary license is effective. So the board is asking for this language so that someone who falls into this category is able to practice limited physical therapy while under supervision. Without this language, what you're suggesting is they could still do that, just
I believe so.
that
That's
language in the law.
correct. And when you talked about conformity between the boards, it seems like they're over-reading or over-interpreting. I
can't
guess.
practice medicine under your supervision, right?
So residents don't have to be licensed because they're practicing under the residency, right? You don't get your license as soon as you get out of medical school. The same thing with there are other medical professions, and I'd have to break it down, but you understand correctly what my question is. I don't understand why they need to have a license to practice, and because anyway, that's the question.
So I think the answer to your question is that different boards have different sets of rules for how direct supervision works and whether there's a need for temporary licensure or not. And that for this board, this is the way that they meet their needs for this category of people, whereas the Board of Physicians has different rules. But I will confirm that.
Okay.
To you.
So as of current, the people practicing right now, basically they're sitting around for 3 months
Without,
because
yes.
they can't do anything.
Right.
Yes.
No need to hold the bill, Madam Chair. If this is what they want and it makes sense to them, God bless them. That's fine. I don't know everything. I just was very confused at the hearing and continue to be, but I appreciated Delegate Kelly. That explanation is fine. They certainly know what they need much, I just am confused about why it's different. Thank you.
I know it is. I will say, Delegate Hill, it is extremely complicated and unnecessarily so that each board has their different legislative history, the different things they've gone through, the different rules they follow. It makes it a little bit complex. Yeah, thank you.
No, thank you.
Any other discussion? All those in favor say aye. All those opposed, no. Raise your hand in the panel.
Aye.
Aye. Aye.
Aye.
Okay, the bill passes unanimously. So I can scribble out the H. And we'll move on to House Bill 297. Tyler.
House Bill 297 would extend the sunset and reporting timeline for the Maryland Truth and Reconciliation Commission. An amendment was adopted in a subcommittee that would correct a typo in the short title of the bill and then extend the deadline a year even further from the original bill, since the director of the commission believes they'll have plenty of funding to extend their work to that extended deadline.
Delegate Rosenberg.
Thank you, Madam Chair. We felt unanimously this was appropriate to continue the work of the commission. Legislation introduced by the vice chair of the full committee and was unanimous favorable. Move the bill as amended. Or move the
Want to move the amendment?
move the amendments.
Second.
All those in favor, is there any discussion? All those in favor say aye or shake your head or something. All those opposed, raise your hand. Okay, the bill passes, or the amendment passes
Move
unanimously.
the bill.
Second.
Second. All those in favor say aye.
Aye.
Oh, is there discussion? Sorry. All those in favor say aye. All those opposed, no. The ayes have it.
Aye.
It's unanimous if I don't see your hand in the panel, which I don't see any hands. Okay. House Bill 484. Erin,
This bill prohibits a healthcare facility from providing peritoneal dialysis or hemodialysis treatment services unless the individual performing the procedure is trained in the technique being performed. There's an amendment that was offered and accepted in the Government Operations and Health Facilities Subcommittee. It was a technical amendment that moved the provisions of the bill from Title 19 to Title 20 of the Health General Article.
okay.
Move the amendment.
Unanimous decision both on the amendment and on the full, the bill as amended by the subcommittee. So I would move the amendment, which is truly technical.
Second.
Is there discussion on the amendment? All those in favor say aye, nod your head. All those opposed, no. Raise your
Aye.
hand. in the
Aye.
Aye.
I see no hands in the panel. The amendment passes unanimously. Move the bill.
Move the bill as amended.
Second.
All those, any discussion? All those in favor say aye. All those opposed, no. Raise your hand. in the
Aye.
panel.
Aye.
Aye.
I see no hands. The bill passes unanimously. Oops, what'd I do? Oh, nothing. You can't even see what I did. I just hit a button, so I got a different screen. Delegate 554. Lisa. Is Lisa back?
I'm here. We did all of mine. I think we already.
Oh, we did. We went through yours. I'm
Yeah.
sorry.
That's okay.
Well, we're done with everybody else's, so we're back to the bill that was held.
Right.
House Bill 107.
And I'm not sure that I have any more information. Delegate Kipke, I mean, you're right. It is a little bit complicated. My understanding is this is a very old statute and it was hard to get information on, like even exactly what the language was, the legislative intent behind the original language was. It's possible because this is dealing with devices that it could prohibit a Band-Aid, but we don't know that for sure. And would probably need to get a letter or an AG's letter or something to figure that out. You know, it does prohibit though all of other over-the-counter medications. So would it prohibit your antacids and Dramamine and others. Delegate Hill, when you were referring to remembering getting aspirin, I guess there is a provision in here that allows the secretary to exempt certain commodities from that section in the vending machine. At one point, the secretary did have a regulation that would allow for aspirin. So.
Oh, okay. I knew my memory, it goes back a long way, but
Yeah.
okay.
But there are
thank you.
46 states either have no restrictions on the sale of over-the-counter in vending machines or authorize the sale. So we're one of the few that does not.
So we're one of 6.
104.
I'm gonna get rid of that.
I heard it
Let's go back
backwards.
to vending
Okay, 1 of
machines.
4. Okay. So who was
Madam
it?
Chair, I've got a little bit of, Krebs has her hand up.
Okay, Krebs.
I just, little bit, I took some notes on this. There's no legislative record of how the prohibition law ever evolved to begin with for Maryland to have it, to have the prohibition to begin with. There's only 4, us included, in 4 states that have the prohibition. And it basically, we do have an attorney general's opinion. And first of all, it's only for over-the-counter drugs, which are self-diagnosed. Everything else, prescription requires a doctor. So it's only for stuff that you could buy over the counter now in a grocery store, in a convenience store, in a drugstore, in a whatever. Currently, condoms, non-prescription pain relief drugs may be sold in vending machines in Maryland. So when you use your examples, I would use the examples instead of using Tylenol, because I think you can do that now, and Band-Aid. I would use like maybe Pepto-Bismol and Kaopectate. They're just little examples. The other ones, I think that would be a little more urgency. So anyway, I think I just use those examples because those can be sold.
It's a
Maybe
medical
people can
term of
relate to
art.
that. Self-diagnosed. Okay, that's just my information on my little notes here.
That's good. That's good.
That is good. Thank you for that, Delegate Krebs. That was a really nice job. I see next is Delegate Johnson, who will be followed by Delegate Chisholm.
Thank you, Madam Chair. And just for the clarity of and benefit of the committee, there will be no Sudafed products allowed to be sold in the vending machine. Is that correct?
That's correct.
Thank you. Thank you, Madam Chair.
Delegate Chisholm.
Delegate Johnson just asked my question. Very good. Thank you.
Okay.
And is that prohibited? Is that Sudafed prohibited in this bill, or is that some other? Because that's an over-the-counter, right?
Sudafed is not over the counter.
Okay, so active fed you could get, but not Sudafed. Okay. Yes, over the counter. You get Sudafed over the counter.
Any other discussion?
There's name brand Sudafed.
They control it, Terry. You know that. It's behind a locked cabinet.
Right.
Well, no, I'm sorry. There's some cold medicines that are sold over the counter, but like if you go to, let's say, Giant, and you try to buy more than 3, they come over and they check because they are trying to control the amount that is being bought at one time. And that's why I had the question, and I'm assuming that's why Delegate Johnson wanted to ask the question as well. So it can be over the counter, but Sudafed you can walk in any store and buy.
But the thing is, with there's those certain medications that require you to give your ID that would not be allowed to be in
okay
the machine. I mean, they're over the counter, but there's another step involved. So those would not be in the vending machine.
And it's my
Excellent.
understanding that Sudafed, or whatever the chemical in Sudafed is, it's prohibited by the FDA to be sold over the counter. It's, has to be behind lock and key. So it's that whatever is in Sudafed.
Excellent. Thank you.
Just to follow up, Madam Chair, that's a highly stolen item. And that's why a lot of pharmacies have put it behind the counter because they use that to make other drugs. That's why I was asking the question.
Okay. Any other questions? Okay. Do you still need to hold the bill? I believe that was Delegate Kipke, wasn't it?
I don't feel like I need to. I do think it's weird. That's all. It's a sort of a peculiar thing, but I don't need to hold the bill.
Okay, I'm not pushing on you. If you're not comfortable, we'll hold it. You know that. Right? I'm good. Thank you. Okay, all right. Thank you.
Delegate Hill's hand is up.
Is your hand up on purpose, Delegate Hill, or did you just forget to take it down? I think she's on another call. Okay, so
No, I'm up. I'm up for a reason.
Oh, well, I couldn't hear you. Go ahead, Delegate Hill. I couldn't hear you.
I was muted. So I wanted to get back to what Delegate Cullison said about it. It's only the over-the-counter stuff, and Delegate Johnson and Chisholm and I saying you can buy that stuff from not behind the counter. And I'm wondering if there is a benefit in putting on an amendment that says that, anything that requires, any special, rules, like limitations, like Chisholm said, if you get more than 3, then they come out. If we need to do any tightening around that, because I know I can get some, he's right about pseudoephedrine, but there are other versions that I know I get all the time.
Madam Chair, it's my understanding that Sudafed is prohibited from being sold in vending machines.
Okay.
So
all right. So federal law prohibits this already.
Correct.
Okay. All right. Never mind then. Okay. Thank you.
Okay. Delegate Bagnall, do you have a question?
I was just following up on that. I believe that federal law prohibits selling it because it's age restricted. So if it was age restricted, I would believe that it couldn't be sold in a vending machine because there is that second level of confirming your age.
Oh, that makes sense. Okay.
Okay.
Now we all know better.
Yes, Madam Chair, I have one.
Oh, Delegate Riley, I'm sorry.
That's okay. Question. So these vending machines, can anyone qualify for a vending machine that has a vending license, or is this just like vending machines in casinos, or is it just wide open? Do we know?
You have to get a certain kind of state license in order to have a vending machine. There's a license involved. So you have to
So if you
qualify
have-
along the
so if you
state
have a-
licensing guidelines.
Okay, so if you have a vending machine that sells candy, then you can have a vending machine that sells over-the-counter drugs. Is
So
that
that would be my interpretation.
okay? All right, thank you.
Any further discussion? Delegate Saab.
Thank you, Madam Chairman. So actually, Delegate Riley brought up an interesting question. So if someone changes, they're already selling candy or whatever, chocolate in their machine, do they have to let the health department know, or someone knows that now this machine is being used to vend medicine? Or how do they know how many are there? Or is it going to be license specific for that, for medications?
It's not license specific, but they do have to have a business license in order to have a vending machine license. So, and there wouldn't be any, reporting of, I just changed my candy machine to the Pepto-Bismol Kaopectate machine.
So they can mix it up, I guess, and
Right.
nobody will know. Okay,
Right.
thank you. Thank you, Madam Chairman.
You're very welcome. Any other questions? Seeing no hands and hearing no voices, I believe we moved the bill and I believe we seconded the bill. And I believe there are no amendments on the bill. Is that all accurate, or did I get something wrong there?
No, Madam Chair, you're right. I just got information that there is a separate license for these kinds of vending machines from candy. So you wouldn't, the candy vending machine license doesn't serve you for OTC vending machines. I'm sorry,
So
Madam
it's
Chair, but I wanted to
specific
add that
license.
information.
Good, thank you for that. We want to be accurate. Okay, all those in favor say aye. All those opposed, no. The ayes have it. If you would like
Aye.
to vote no, please
Aye.
raise your hand in the box. Delegate Kipke, you're voting no. Delegate Morgan, Delegate Saab, Delegate Riley, Delegate Shalega, and Delegate Chisholm. Another one of those. Okay. But we're all good, right?
Yes.
Okay, excellent. That is the last bill, I believe, of the day. So with that, is there anything anybody needs to mention before we adjourn? Then,
Delegate
Happy
Chisholm.
President's Day and belated Happy Valentine's Day.
yeah, to everybody.
Because Aaron's got that Valentine's tree up and everything.
Everybody, I'll see you all tomorrow on the floor at 10 a.m.
Have a good
Thank you,
night.
Madam Chair. Good evening.
We
Thank you
stand
so much.
adjourned.
Good night.